Welcome to the deep dive. We sort through the science, cut through the noise, and really try to bring you the core nuggets of knowledge. Today we're tackling something pretty interesting, a biological puzzle really. It's about an organism that, for the most part, lives quietly inside its host, totally harmless. Until, well, something flips a switch, and suddenly it turns into a serious, even economically damaging threat. We're doing a deep dive into Mycoplasma hyorhinis. It's a bacterium that really shows this kind of dual nature perfectly. And it's not just some biological curiosity, it's a huge deal in the global pork industry. Cost producers millions.
That's exactly right. So our mission today is to, unpack the story of Mycoplasma hyorhinis. We want to look at how it goes from being this quiet resident, a commensal, to a full-blown systemic pathogen, what makes that happen. We'll get into its impact, diagnosis, how we control it. Basically, we've boiled down the key stuff so you, our listener, can get the crucial insights fast without digging through all the papers.
And believe me, we've waded through plenty of research papers and expert analyses for this one. We've sifted through it all to pull out what really matters for you. Okay, let's unlock this mystery. Okay, so let's start with the origin story, which is kind of surprising. For a long time, Mycoplasma hyorhinis, well, it was just seen as a commensal organism. Like, think of that neighbor who's super quiet, lives next door for years, doesn't cause any trouble, just, coexisting peacefully inside the pig.
Exactly. It was just there. But what makes it really unique, biologically speaking, is its structure. It completely lacks a cell wall.
No cell wall at all.
None. And that's not just some tiny detail. It's a huge adaptation. It makes it different from most bacteria. It does make them vulnerable in some ways, sure, but also helps them hide from certain immune responses. And crucially, like we'll get into later, it makes them naturally resistant to certain antibiotics. Oh, and it's gram-negative, too.
Right. The antibiotics that target cell walls won't work. Okay? And despite this weird structure, it's basically everywhere.
Pretty much, yeah. Global distribution. It commonly sets up shop in the upper respiratory tract of healthy pigs. Especially the tonsils, it's a very common resident.
So how do pigs usually get it? Little piglets, where do they pick it up?
Typically, it's early in life. Oronasal contact, so nose to nose, with their mothers or maybe older pigs that are carrying it. Very young piglets might not have much, but after weaning, the colonization rates just shoot up. We've seen studies showing almost like 98% of nursery pigs can end up colonized.
Wow, 98%?
Yeah. And besides direct contact, there's aerosol transmission, possibly even vertical, from the sow to the piglets before birth.
Okay, so here's the big question then. It's everywhere, usually harmless.
Yeah.
Then boom, it causes serious disease. What's the secret sauce? What actually flips that switch?
That's the million-dollar question. It's complex, and we're still figuring out all the details, but it's not random. Basically, clinical disease kicks off when specific things line up. Factors that create this kind of perfect storm scenario that really hits the pig's immune system. That compromise essentially opens the door for M. hyorhinis to spread and cause trouble.
Okay, so let's break down those factors. The first big one you mentioned is stress. Now, we're not talking about a pig just having a bad day, right? This is specific stuff.
Right, not just general anxiety. We mean major physiological stressors common in farming. Think about weaning huge stress, transport, mixing pigs that don't know each other, overcrowding. These things trigger a stress response that actually suppresses the immune system temporarily.
So the pig's defenses are down.
Exactly, defenses are lowered. And that gives M. hyorhinis, which was maybe just sitting quietly in the tonsils, a chance to get into the bloodstream and spread systemically.
Okay, that makes sense. Then there's waning maternal immunity. You said piglets are most susceptible around 3 weeks old. Why that specific time?
It's all about timing. That's the point when the antibodies they got from their mother's colostrum, that really important first milk, start to wear off. Their levels naturally dip. So you have this window where their own immune system isn't fully mature and mom's protection is fading.
Right, when other stresses like weaning might be happening.
Oh, precisely. It's a vulnerable period.
And then you add co-infections on top of that. So if the pig's already fighting something else off,
that makes it much, much easier for M. hyorhinis. If the immune system is already battling another infection, especially viruses that suppress immunity, like PRRS virus or PCV2.
Oh, PRSV and PCV2 are major players here.
Huge players. They basically pave the way. They damage respiratory tissues, suppress immune cells. It's like they unlock the door and invite M. hyorhinis in to cause systemic problems.
Yeah.
And it's not just those two. Other things like swine flu or even just a general bacterial pneumonia can contribute.
So multiple hits weakening the system.
Yep. And don't forget, poor environmental conditions. Things like high dust, bad ventilation, high humidity. They might seem minor, but they constantly irritate the airways. That irritation makes it easier for bacteria like M. hyorhinis to get a foothold and potentially invade. So you put these triggers together: stress, low immunity, other infections, maybe poor air quality, and M. hyorhinis escapes the respiratory tract. It goes systemic, causing inflammation of those internal linings, the serous membranes, it's polyserositis and inflammation in the joints, the synovial membranes, causing arthritis.
Okay, so the switch is flipped, the triggers are there, and M. hyorhinis goes systemic. What does that actually look like in the pig? Who gets sick, and what are the signs we'd see?
Typically, you're looking at nursery pigs, usually between, say, 3 and 15 weeks old. That's the main window. And the first signs often pop up pretty quickly after exposure to those triggers, maybe 3 to 10 days, things like fever, just being sluggish, lethargic.
Okay, general signs first, but then it gets more specific with the polyserositis and arthritis, right? Let's start with polyserositis. What does that look like?
Right. Polyserositis is inflammation of those linings, the pleura around the lungs, the pericardium around the heart, the peritoneum in the abdomen. This causes some pretty clear signs. Pigs might look tucked up, like their belly is drawn in. They'll be tender if you touch their abdomen. Often, they prefer to lie down on their chest, on their sternum, probably because it eases the discomfort, and you'll definitely see respiratory signs.
Labored breathing.
Yeah, labored breathing, maybe faster breathing, dyspnea, because that inflammation is literally squeezing the space around their lungs and heart. It's painful, clearly.
That sounds rough. And the second big one is arthritis. How does that show up?
This is usually polyarthritis, meaning multiple joints are affected, and it's painful. You'll see obvious lameness, sometimes severe. Swollen joints are a key sign, and the pigs just really don't want to move.
Which joints are most common?
Often the bigger ones stifle, like our knee, hock, ankle, elbow, carpus, wrist. Those are typical targets. And beyond those two main things, you might see other signs. A rough hair coat, they might go off their feet a bit, moderate appetite loss. And occasionally you can get otitis, an ear infection, which might cause a head tilt.
How bad does it usually get in a group of pigs? Are we talking high death rates?
You know, in established herds that have likely seen it before, morbidity, the number sick, might be moderate, maybe 20, 35%. Mortality is often low in those cases.
There's always a but.
But if it hits a naive herd, one with no prior immunity, or if those trigger factors are really severe, then yeah, morbidity and mortality can be high, really high. And even for the pigs that seem to recover, the infection can linger in the joints. This leads to chronic issues, poor growth being a big one for producers.
Right, the chronic phase. What happens if it's not treated effectively?
If it becomes chronic, you get persistent lameness, joints stay swollen, growth remains poor. Internally, you get fibrosis that's scar tissue. These fibrous adhesions can form, kind of like internal glue, sticking organ surfaces together or permanently damaging the joint linings.
And if you were to do a postmortem, a necropsy, what are the classic findings?
The hallmark is that serofibrinous exudated. It's this yellowish, sometimes cloudy, sticky stuff coating the surfaces of the heart, lungs, abdominal organs. Looks like fibrin strands. In chronic cases, this turns into those tough, fibrous adhesions you mentioned. In the joints, you'll find excess joint fluid, synovial fluid. It might be yellow or brownish, cloudy, maybe with fibrin flakes floating in it. And the joint lining itself, the synovial membrane, looks thickened, red, inflamed. Sometimes it gets this kind of velvety appearance. It's called villus hypertrophy.
Okay, so we know what it looks like clinically, but you mentioned earlier it's tricky to diagnose. A bit like detective work. Why is it so difficult?
Yeah, the big challenge is mimicry. The clinical signs, the lameness, fever, breathing issues, and even the lesions you see at necropsy, they look almost identical to other common nursery diseases. Specifically, Glasserella parasuis, which causes Glasser's disease, and Streptococcus suis. They can all cause very similar polyserositis and arthritis.
So, just looking at a sick pig, you might not be able to tell them apart easily.
Not easily, no. It requires more investigation.
Is there any clue, though? Anything that helps point toward mycoplasma versus the others?
There is one potentially helpful clue. Meningitis inflammation around the brain and spinal cord is pretty common with Glasserella and Strep suis.
Yeah.
But it's typically absent in Mycoplasma hyorhinis arthritis cases. So if you see polyserositis and arthritis without signs of meningitis, M. hyorhinis moves higher up the suspect list.
Ah, that's a really useful distinction. So given this confusion, getting the right diagnostic samples is crucial, isn't it?
Yeah, absolutely critical. You have to remember, M. hyorhinis is commonly found in the nose and throat of healthy pigs. So to diagnose disease, you need samples from places it shouldn't normally be. systemic sites.
Okay, so what are the appropriate samples then?
You want joint fluid from an affected joint, or a piece of the synovial membrane itself. Or, if you're doing a necropsy, swabs taken right from those fibrinous lesions on the pleura, pericardium, or peritoneum.
And what's inappropriate? What shouldn't people send?
Nasal swabs, tonsil swabs, oral fluids, those are no good for diagnosing systemic disease. They just tell you the pig is colonized, which we already know is common. They're useful maybe for monitoring herd status, but not for confirming active polyserositis or arthritis caused by M. hyorhinis.
Got it. Sample site matters. And sample quality too, presumably.
Yes. Always sample acutely affected pigs, the ones showing signs right now, and ideally pigs that haven't been treated with antibiotics yet, as that can interfere with testing.
Okay, so you get the right sample. What tests do the labs run?
The gold standard, really, is PCR polymerase chain reaction. It's highly sensitive and specific for detecting the organism's DNA. That's especially important because actually culturing M. hyorhinis is tricky. It's fastidious, needs special media, grows slowly.
So PCR is generally preferred over culture.
Generally, yes. Culture can still confirm it if successful, but PCR is often faster and more reliable. Serology, testing blood for antibodies, can show exposure but doesn't confirm active infection is causing the current signs.
Right. Okay, let's talk treatment. If you do get a diagnosis, what's the approach?
The key is acting fast. Prompt and aggressive treatment early on gives the best chance. Once those chronic changes, the fibrous adhesions set in, the prognosis gets much poorer. The damage can be permanent.
And this loops back to that unique feature, no cell wall. How does that dictate antibiotic choice?
Massively. Because it lacks a cell wall, all the beta-lactam antibiotics are useless. Penicillins, cephalosporins, they work by disrupting cell wall synthesis, which this organism doesn't have.
So scratch those off the list immediately?
Immediately, they just won't work.
So what does work? What are the effective antimicrobials?
Drugs like lincomycin, tylosin, tetracyclines are often used, though you can see variable results sometimes, maybe due to strain differences or resistance. Tiamulin is another important one. Clindamycin, some sulfonamides, have also shown efficacy. It often requires consulting with a vet and possibly doing susceptibility testing if possible.
And it's not just about antibiotics, is it? You mentioned inflammation.
Absolutely. Anti-inflammatory drugs are crucial. NSAIDs like flunixin, meglumine, or sometimes even corticosteroids, they help reduce that severe joint pain and inflammation, which can limit the long-term damage. It's really a two-pronged approach. Hit the bug and calm the inflammation.
Plus supportive care, I imagine?
Definitely. Good nursing care, clean, dry, comfortable bedding. Make sure they have easy access to feed and water. Maybe isolate the really sick ones to reduce stress and spread. It all helps.
Okay, treatment is one thing, but prevention is always better, right? So how do we stop Mycoplasma hyorhinis from causing problems in the first place? And this is where we hit a bit of a wall, isn't it?
We do hit a significant hurdle, yes. The big one is the lack of widely available commercial vaccines, at least in Europe and the US. There's research into autogenous vaccines, custom ones made for a specific farm, and inactivated bacterians show some promise, but there isn't an off-the-shelf product producers can easily use everywhere yet.
So no simple vaccine solution. That means prevention have to focus elsewhere. Back to those triggers.
Exactly. Prevention really boils down to minimizing those predisposing factors, stopping that perfect storm before it starts. So it's all about solid management. Reducing stress is huge, managing weaning carefully, minimizing transport stress, avoiding overcrowding, being smart about mixing groups of pigs.
Good husbandry, basically.
Good husbandry, absolutely. Ensuring excellent ventilation and air quality is key too. Reducing respiratory irritation. And critically, controlling those other diseases. Having robust programs for PRRSV, PCV2, influenza, other bacterial pneumonias, that helps close the door on M. hyorhinis.
So keeping the pigs generally healthy makes them less susceptible.
Precisely. In some situations, maybe in herds with a known recurring problem, vets might recommend strategic use of prophylactic antibiotics during high-risk periods, like around weaning. But that's a decision needing careful veterinary guidance.
Okay, let's talk bottom line. We mentioned it cost the industry millions. Let's drive home the economic impact. Where do the losses actually come from?
The costs add up in several ways. First, and maybe most consistently, is reduced performance. Affected pigs just don't grow as well. They have lower average daily gain, worse feed conversion. This can drag on for months, meaning pigs take longer to reach market weight. That costs feed, time, barn space.
So slower growth is a big one.
A huge one. Second, while maybe not always causing high herd mortality, it is a significant cause of death. Increased mortality specifically in those nursery pigs hit with severe polyserositis. Losing young pigs is a direct loss.
Then the obvious treatment costs.
Yep. The cost of the antibiotics, the anti-inflammatories, the vet's time, the labor for treating sick pigs, it all adds up.
And you mentioned its role in making other diseases worse.
Yes, this is a really important, often underestimated impact, its role in disease complexes. Think of it as an amplifier. When M. hyorhinis gets involved alongside something like PRRS or enzootic pneumonia, the overall disease picture, the lung damage, the performance loss, it all gets significantly worse than either pathogen would cause alone. It makes bad situations truly devastating economically.
It really piles on. Do we have any numbers to illustrate how common it is in these disease situations?
Yeah, there was one report, for instance, looking at diagnostic submissions. It found M. hyorhinis was detected in something like 55% of the polyserositis cases they tested,
Wow, over half.
and about 12% of the arthritis cases. That really shows just how frequently it's involved when pigs show these signs, highlighting the major financial burden it represents for producers worldwide. Hashtag tagged outro.
So we've really followed the trail here, from what seems like a harmless resident, almost universally present in pigs, to a major economic pathogen. And the key seems to be this convergence, this perfect storm of stress, immune status, and other infections. It's quite a story.
It really is, and it underlines a critical point, I think. Understanding infectious diseases isn't always just about the bug itself. It's so often about the complex dance between the pathogen, the host's condition, and the environment. How these seemingly small factors, these stressors, can completely change the outcome and allow an otherwise quiet organism to cause severe disease.
It's a lesson in context, really. So thinking beyond pigs, what does this mean for you, our listener? Maybe consider how these hidden or conditional threats could be relevant elsewhere. Maybe in other agricultural systems, maybe even in human health. Think about microbes or conditions that are usually benign, but could become problematic under just the right or wrong set of circumstances. What other surprising dual nature players might be out there, just waiting for their own perfect storm to reveal their full potential? Something to think about.